यूनिवर्सल इम्यूनाइजेशन प्रोग्राम। यूनिवर्सल इम्यूनाइजेशन प्रोग्राम पहले एक्सपांडेड प्रोग्राम फॉर इम्यूनाइजेशन के नाम से जाना जाता था, दैट इज ईपीआई. ईपीआई इज एक्सपांडेड प्रोग्राम फॉर इम्यूनाइजेशन and it was enacted or established in 1974 globally, that is worldwide. 1974 में उसको establish किया था. Then after 4 years, that is 1978 में इसको इंडिया में establish किया था. So it was first EPI, that is expanded program for immunization. Then UNICEF renamed it as UIP, that is Universal Immunization Program, in the year 1985. So basically इस ये प्रोग्राम में हम लोगों को ये 3 साल जो है वो याद करने हैं, दैट इज़ द मोस्ट इम्पॉर्टेंट. 1974 में ग्लोबली आया था, 1978 में इंडिया में आया था एंड 1985 में उसको रीनेम किया था बाय यूनिसेफ एज यूनिवर्सल इम्यूनाइजेशन प्रोग्राम. नाउ ये EPI जो था दैट इज एक्सपांडेड प्रोग्राम फॉर इम्यूनाइजेशन. इट वॉज फॉर द प्रिवेंशन ऑफ 6 वैक्सीन प्रिवेंटेबल वैक्सीन्स. ठीक है, वैक्सीन प्रिवेंटेबल, यहाँ पे डिजीज होना चाहिए, वैक्सीन नहीं होना चाहिए. सो 6 वैक्सीन प्रिवेंटेबल डिजीजेस जो है उसके प्रिवेंशन के लिए EPI को लॉन्च किया था. सो इसको याद कैसे करना है, DPTPTM. DPTPTM. D is basically the diphtheria, then this is polio, tetanus, okay, then pertussis, then we have got TB and measles. Okay, so it is diphtheria, tetanus, pertussis, polio, TB and measles. You can remember by this, like DPTPTM. So this was for UPI. Okay, then we have got universal immunization program, which was renamed as a part of CCM program earlier CSSM. So what is the full form of CSSM? It is child survival and safe motherhood. So CSSM is a child survival or safe motherhood program. It was earlier renamed as a part of CSSM program. From CSSM program, it was later a part of RCH, reproductive child healthcare program, and now presently the UIP, that is Universal Immunization Program, is running under or is a part of National Rural Health Mission, NRHM, since the year 2005. So again, one of the important year to remember, since 2005 it is a part of National Rural Health Mission. Now, what was the goal? Goal was to achieve universal immunization by the year 1990. So first we'll study about the aim. Aim क्या थी? First था to achieve 100% coverage for pregnant women with 2 doses of tetanus toxoid. TT is tetanus toxoid. So 100% coverage for the pregnant woman with just 2 doses of tetanus toxoid. And second was at least 85% coverage of infant with 3 doses each of DPT, OPV and BCG. इसको D of B, date of birth, that is DPT, OPV and BCG. Okay, for infant with 3 doses each of DPT, OPV and BCG and 1 dose of measles. ठीक है, बाय 1990. यही है जो 1990 तक ये 2 एम्स को एस्टैब्लिश करना था. सो दिस वाज द गोल एंड एम्स. सेकेंड है ऑब्जेक्टिव. व्हाट इज द ऑब्जेक्टिव? ऑब्जेक्टिव था रैपिडली, अभी यूनिवर्सल इम्यूनाइजेशन है, इम्यूनाइजेशन के वर्ड से आई से आप लोगों को फर्स्ट ऑब्जेक्टिव याद रखना है, रैपिडली इंक्रीज्ड इम्यूनाइजेशन कवरेज इन चिल्ड्रन एंड प्रेग्नेंट वुमेन, जो अभी अपन ने देखा एम्स में. सो रैपिडली इम्यूनाइजेशन करना है. ठीक है, फिर इससे क्या हो जाएगा, रिड्यूस्ड मॉर्बिडिटी एंड मोर्टेलिटी ड्यू टू व्हाट इज दिस, वैक्सीन प्रिवेंटेबल डिजीजेस. सो वी हैव टू रिड्यूस द मॉर्बिडिटी एंड मोर्टेलिटी रेट ड्यू टू वैक्सीन प्रिवेंटेबल डिजीजेस. देन यूनिवर्सल का यू, दैट इज अचीव यूनिवर्सल कवरेज विद क्वालिटी सर्विसेज. अचीव universal coverage with quality services and sustain a polio-free status and eliminate the remaining diseases, those 6 diseases, that is this diphtheria, tetanus, pertussis, TB, measles and polio status free. Okay, So first is rapidly increased immunization coverage in children and pregnant women. We have to reduce morbidity and mortality due to vaccine preventable diseases. And then we have got achieve universal coverage with qualitative services and sustain polio free status and eliminate the remaining diseases. So here are 11 vaccines which are covered under universal immunization program. So how can you remember is first BOH, then we have got PVV, RVV. Then we remove one V and we add C, that is PCV. Now that C also we have to remove. So it is PV, FLPV, FLPV. Now this was RV, remove one V, that will be RV. So MRV, then GIV, DPT, TTT. GIV, DPT and TTT. This way you have to remember this. So BOH, B is BCG. BCG is Bacillus calmette-guerin, which is used in TB, that is tuberculosis. OPV is oral polio vaccine. The name itself suggests it is used for polio. Then is HBV, that is hepatitis B vaccine, hepatitis. So these are the disease, these are the full forms, and these are the vaccines. So PVV is pentavalent vaccine. Penta is 5. Now the trick is dipti. Dipti is diphtheria, influenza, pertussis, tetanus and hepatitis B. RVV is rotavirus V. Rotavirus for rotavirus diarrhea. PCV is pneumococcal vaccine for pneumonia. FLPV is fractional inactivated poliomyelitis for poliomyelitis. Then MRV is measles, rubella vaccine for measles and rubella. JEV for Japanese encephalitis vaccine for Japanese encephalitis. DPT is diphtheria, pertussis and tetanus for these disease itself, and tetanus oxide for diphtheria. Alright. So these are the the strategies will be common strategies, like we have got preventative strategies. In preventative strategies we have got information, education and communication activities or community awareness activities, right, and the diagnosis activities, right, the vaccination and all. These are the common points you have to write in strategies. And in addition you have got special campaigns. So in addition, we have got special campaigns. Basically, it is Mission Indradhanush. It is very important. Indradhanush is basically a rainbow which consists of 7 colors. So it is used to treat 7 vaccinations are included in that, which is from 2014 onwards. So in strategies, you have to write common and special campaigns called as Mission Indradhanush 2014 onwards. Now those 6 diseases which I mentioned earlier, this this 6 disease plus hepatitis B are the 7 disease whose vaccinations are included in Mission Indradhanush. Okay. Then achievement is very important point. India polio free from 2014. India became polio free in 2014, which is certified by WHO. WHO certified as India as a polio free India in 2014. So this was a very important achievement. Then is significant decline in all the other rest of the disease except polio. Then reduced child mortality by 75%. The child mortality was reduced by 75%, saved 27 million child lives annually and prevented 1 lakh infants death. So these was the achievements. So you guys can take a screenshot of this. One more important point is the challenges. The incomplete coverage in remote, slum and tribal areas. Shortage of trained health staff की कमी होना, that is the shortage, and incomplete coverage due to the remote place, slum areas or tribal areas, and high dropout rate between first and the subsequent doses. So these were the challenges.